The committee will come to order. At the conclusion of opening statements yesterday, the chair called up H.R. 3670, and the bill was open for amendment at any point. The chair now recognizes Mr. Barton to offer an amendment in the nature of a substitute. Mr. Barton.
Thank you, Mr. Chairman. I have an amendment at the desk.
The clerk will report the amendment.
Amendment in the nature of a substitute to H.R. 3670, offered by Mr. Barton of Texas.
Without objection, the reading of the amendment is dispensed with. The gentleman is recognized for 5 minutes in support of his amendment.
Mr. Chairman, we introduced this bill last year, and it's got broad bipartisan support. The amendment that I'm offering today, the nature of a substitute, takes out two sections of the bill. One section of the bill, this section 2B, had a specific definition of spoofing and allowed the FCC the ability to prescribe regulations that would require a provider of a spoofing services to notify people about that service. Many of the stakeholders felt that as currently written, Section 2B in some way might give the FCC more authority than they really needed. And so the amendment in the nature of a substitute takes out Section 2B and 2C2 with the understanding that some of the information in those two sections will be clarified and included in report language on the bill. This is a bipartisan amendment. I'm not aware that there's any opposition to it. As the Republican author of the bill, I think it certainly removes some concerns, and I don't think it detracts from the intent of the bill. So I would hope the committee would accept the amendment in the nature of a substitute.
And do you yield back the balance?
Yield back.
Gentleman yields back the balance of his time. Is there further discussion on the amendment? See none. The question now arises on the Barton amendment in the nature of a substitute. All those in favor will say aye. Aye. Those opposed, no. The amendment is agreed to. Then we got to go to the next ones. Are there further amendments to the bill? See none. The question now occurs on favorably reporting H.R. 3670 as amended to the House. All those in favor shall signify by saying aye. Aye. Those opposed, no. The ayes have it. The bill is favorably reported. Next. The chair calls up H.R. 5161 and asks the clerk to report.
H.R. 5161, to promote the non-exclusive use of electronic labeling for devices licensed by the Federal Communications Commission.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point. So ordered. Are there bipartisan amendments to the bill? Are there any amendments to the bill? The question now occurs on favorably reporting H.R. 5161 to the House. All those in favor shall signify by saying aye. Aye. All those opposed, no. The ayes appear to have it. The ayes have it. The bill is favorably reported. Chair calls up H.R. 1575 and asks the clerk to report.
H.R. 1575, to amend the Communications Act of 1934 to require a provider of a commercial mobile service or an IP-enabled voice service to provide call location information concerning the user of such a service to law enforcement agencies in order to respond to a call for emergency services or in an emergency situation that involves risk of death or serious physical harm.
Without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point. So ordered. The chair recognizes himself for amendment in the nature of a substitute. I have an amendment at the desk. The clerk will report the amendment.
Amendment in the nature of a substitute to H.R. 1575, offered by Mr. Walden of Oregon.
Without objection, the reading of the amendment is dispensed with, and I'm recognized myself for 5 minutes to describe the amendment. Technology has made our lives measurably better. Most Americans carry in their pockets the kind of computing power and access to information our parents could only dream of through the works of Isaac Asimov or H.G. Wells. But today, smartphones give us near ubiquitous access to the collective knowledge of the Internet, connect us to loved ones around the globe, and perhaps most importantly, can pinpoint our locations. I'm honored to offer this amendment in the nature of a substitute to the Kelsey Smith Act. Now, this was a bill first introduced and strongly advocated by my colleague, Mr. Yoder of Kansas. In an age when our smartphones are smart enough to show our boarding passes on a screen at the airport or our loyalty card when we or near a local coffee shop, it's startling that the same technology could be inaccessible to emergency personnel when they need it most. Imagine it's getting late and that you haven't heard from your daughter. Her car is located in a local parking lot, but she's nowhere to be found. And that even though she's carrying a phone that could give police her location, that information remains locked up behind a bureaucracy at the wireless provider, and in a system that places the burden on the wireless provider to ascertain whether it's an emergency or not, or risk suit if in error. That's the scenario that played out 7 years ago in Overland Park, Kansas. This amendment, in the nature of a substitute, would ensure that no family has to go through what that family went through in a scenario like that again. And it would give law enforcement the tools to gather location information during real emergencies. Some have criticized the bill as too broad or a threat to privacy, and that's simply not the case. This amendment creates 3 discrete categories of situations in which emergency providers would apply. First, when the officer believes that a life is in danger. Second, when the officer believes that a person is in danger of serious physical harm. And finally, when a person calls for emergency services. Think about that for a second. Under current law, if you call 911, which sends your location to 911 operators, and the connection is lost for some reason, law enforcement would have to ask your wireless carrier for your local information and wait for the carrier to decide if it's an emergency or go get a court order. By calling 911, a person is clearly and unambiguously reaching out for help. Why then do we ask wireless carriers to divine whether they believe an emergency exists before releasing location data or to bear responsibility for the actions of law enforcement seeking information? Importantly, this amendment also contains provisions to ensure that law enforcement officers do not use this emergency exception by misuse it. First, the officer must provide a sworn written statement under penalty of perjury that lists the facts of the situation. Second, the officer must have probable cause to believe that an emergency situation actually exists. And finally, within 48 hours after availing themselves of this emergency provision, the law enforcement agency must go to the courts and request validation of their good faith belief. I believe that the benefits of this powerful tool, combined with court oversight, provide the right balance to save lives and prevent abuse. As the Washington Post editorial pointed out, this law saves lives using existing technology, does not cost taxpayers a dime. Versions of this legislation have been passed in 14 states, and it's time for it to move forward at the federal level. We can't go back and prevent what happened to Kelsey Smith, but we can ensure that no family has to endure what Greg and Missy Smith did for 5 days in 2007. That can be Kelsey's legacy. So I thank Mr. Yoder for his tireless work to champion this legislation. I urge my colleagues to join me in accepting this amendment and voting to move this legislation for consideration to the House of Representatives. I yield back the balance of my time. Is there further discussion on the amendment? The chair recognizes the gentleman from California, Mr. Waxman, for 5 minutes.
Thank you, Mr. Chairman. I move to strike the last word. In my opening statement for the markup yesterday, I mentioned one lesson I learned long ago from John Dingell, which is that procedure is substance and that a bad process can produce bad bills. This is a case where a hearing and subcommittee markup could have made a difference in the quality of our work. That said, I also want to recognize that the majority has worked with us over the last few days to try to improve this bill. This has been a genuine effort on the majority's part, and I express my gratitude to them for that. I will support the amendment in the nature of a substitute offered by Mr. Walden today because it reflects significant progress made on a bipartisan basis to improve this bill. Specifically, the amendment adds new privacy protections, such as ensuring that a law enforcement officer's request for location information is accompanied by a sworn written statement. It also requires public safety to obtain a court order within 48 hours after a request for location information has been made. At the same time, the new provisions do not undermine the bill's intent to provide public safety officials with the ability to locate a user in an emergency situation involving risk of death or bodily injury. Nevertheless, given the complexity of the bill and the minimal amount of time we are giving to review it, I remain concerned that additional issues may warrant further consideration. For example, privacy and civil liberty groups have pointed to the lack of specific remedy, such as a penalty for police misconduct or the ability to suppress evidence when a reviewing court finds that the law has been violated. They've also pointed to the lack of narrow definition of what constitutes an emergency and whether the bill properly connects the emergency to the records being sought. So while I support moving this bill through committee on a voice vote and appreciate the majority's willingness to work together to improve this bill, there's still work to do before the legislation is ready for the floor. I'm hopeful we'll use the upcoming recess every day in August to solicit the views of privacy experts, to consult with the Judiciary Committee, which has special expertise in some of the legal issues involved, and to further refine this bill. So with those complaints, I look forward to—
And blessings.
looking forward to working together on this bill.
Appreciate that.
It's much needed.
Would you mind yielding to Ms.
I'd be pleased to yield to Ms. Escher.
I thank the gentleman for yielding. I also support passage of the Kelsey Smith Act. It's a bill that would assist law enforcement in obtaining critical location information during an emergency. And this is an issue that we've worked on in different ways over the years. It's very important. I think it's disappointing that such a complex bill was really not vetted at the subcommittee, but I do appreciate the important changes offered by Mr. Walden to address privacy concerns. These changes take steps to ensure that the data is only provided when law enforcement provides a sworn statement attesting to the probable cause for the risk of danger or serious physical injury, and that disclosure without delay is therefore required. I hope we can address any outstanding issues prior to the House floor so that we can ensure that the law, that the law provides the timely access to location information, and we know that that's a potentially life-saving tool. So, Mr. Chairman, thank you for what you're offering. I think you're hearing the same theme here on this side of the aisle, and I think that in working together, we can really present a very solid bill on all fronts to the full House. So with that, I'll yield back.
The gentleman or gentlelady would yield. I would just concur, and we look forward to working with you in a very good faith effort to get this right, but also to be able to move it in the limited time we have. So I appreciate the cooperation of your staff and yourselves on this effort. Is there further discussion on the amendment? If not, the question now arises. All those in support of the Walden Amendment in the nature of a substitute will say aye. Aye. Those opposed, no. The ayes appear to have it. The ayes have it, and the amendment is agreed to. Is there further discussion on the bill? If not, the question now arises on the favorably reporting H.R. 1575 as amendment to the House. All those in favor shall say aye. Aye. Those opposed, no. The ayes appear to have it. The ayes have it, and the bill is favorably reported. Okay.
The chair calls up H.R. 4067 and asks the clerk to report.
H.R. 4067 to provide for the extension of the enforcement instruction on supervision requirements for outpatient therapeutic services and critical access and small rural hospitals through 2014.
Without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point. So ordered. Chair recognizes himself for 5 minutes. H.R. 4067, A bill introduced by Congresswoman Lynn Jenkins is a common sense solution to a problem caused by CMS that has the potential to limit or delay access to health care for seniors in rural areas of the country. The bill would delay until the end of the year enforcement of supervision requirements for outpatient therapeutic services in critical access hospitals to give CMS and provider groups time to identify which services will fall under the requirement. This legislation was passed by unanimous consent in the Senate. And I want to thank Congresswoman Lynn Jenkins for her leadership in bringing this bill forward in the House, and I urge my colleagues to support the bill. Yield back. Are there bipartisan amendments to the bill? Okay. Are there any other amendments? If not, the Chair recognizes the ranking member of the Health Subcommittee, Mr. Plone, for 5 minutes.
Thank you, Mr. Chairman. I move to strike the last word. I am not clear why the committee bypassed regular order to mark up H.R. 4067. This bill would prevent the Centers for Medicare and Medicaid Services from enforcing physician supervision standards in rural and critical access hospital outpatient facilities. This seems to be an issue important enough that we would want to learn the facts of the situation before legislating. The standards the bill would suspend enforcement of have been in place since January of this year with no ill effect as far as anyone has been able to tell me. And now 7 months into the year, we're marking up a bill that would stop enforcement of the standards for the next 5 months. And anecdotally, I've heard of some providers concerned with the CMS supervision standard. They reason that we need to bar CMS from enforcing these rules because patients could complain or a whistleblower could file a complaint that a facility was allowing staff to practice medicine on Medicare patients without any supervision. But isn't that the kind of thing we might be concerned about and want a whistleblower to report? Yet that's just what this bill would stop. I'm not aware of CMS taking action against a facility for failure to meet physician supervision standards since January, and we haven't heard of any patient access issues over the past 7 months. We haven't even had the ability to hear the administration's views on the enforcement of physician supervision requirements. And I understand, Mr. Chairman, that sometimes rural facilities face difficulty in securing staffing, but in this instance, ensuring that the providers in remote regions that are performing services on patients have appropriate supervision, whether that is in person or immediate availability by phone in case of an unforeseen emergency, seems to make sense. In many cases, if something goes wrong, it could take much longer to get assistance. So my point, Mr. Chairman, and you know I've reiterated this in subcommittee, and I'm going to reiterate again, that this issue warrants further exploration so that we can understand the effect of suspending CMS's enforcement ability before we move ahead to legislate. And it's the same problem. We should have regular order. When we don't have both a hearing and a markup in subcommittee, then we don't have an opportunity to hear from the administration and hear from all the members as to whether or not this type of legislation is necessary. And so under the circumstances, I think that we're making a huge mistake in moving forward with this markup. And again, I know that the regular order of the subcommittee has been bypassed. I think that's wrong, and I don't want us to continue to do that. Thank you, Mr. Chairman.
Chair thanks the gentleman. Is there any other discussion on the bill? The question now occurs on favorably reporting H.R. 4067 to the House. All those in favor shall signify by saying aye. Aye. All opposed, no.
Mr. Chairman, I'm asking for a recorded vote on this.
All right. The clerk will
Mr. Hall.
do the roll.
Mr. Barton. Aye. Mr. Barton votes aye. Mr. Whitfield. Mr. Shimkus. Mr. Shimkus votes aye. Mr. Pitts. Mr. Pitts votes aye. Mr. Walden. Mr. Walden votes aye. Mr. Terry. Mr. Terry votes aye. Mr. Rogers. Mr. Murphy. Mr. Murphy votes aye. Mr. Burgess. Mr. Burgess votes aye. Mrs. Blackburn. Mrs. Blackburn votes aye. Mr. Gingrey. Mr. Gingrey votes aye. Mr. Scalise. Mr. Latta. Mr. Latta votes aye. Mrs. McMorris Rogers. Mr. Harper. Mr. Harper votes aye. Mr. Lance. Mr. Lance votes aye. Mr. Cassidy. Mr. Guthrie. Mr. Guthrie votes aye. Mr. Olson. Mr. Olson votes aye. Mr. McKinley. Mr. McKinley votes aye. Mr. Gardner. Mr. Gardner votes aye. Mr. Pompeo. Mr. Kinzinger. Mr. Kinzinger votes aye. Mr. Griffith. Mr. Griffith votes aye. Mr. Billarakas. Mr. Billarakas votes aye. Mr. Johnson. Mr. Johnson votes aye. Mr. Long. Mr. Long votes aye. Mrs. Elmers. Mr. Waxman. Mr. Waxman votes no. Mr. Dingle. Mr. Pallone. Mr. Pallone votes no. Mr. Rush. Ms. Eshoo. Ms. Eshoo votes aye. Mr. Engel. Mr. Green. Mr. Green votes aye. Ms. DeGette. Ms. DeGette votes aye. Mrs. Capps. Mr. Doyle. Mr. Doyle votes aye. Ms. Schakowsky. Mr. Matheson. Mr. Butterfield. Mr. Barrow. Mr. Barrow votes aye. Ms. Matsui. Ms. Christensen. Ms. Castor. Ms. Castor votes no. Mr. Sarbanes. Mr. McNerney. Mr. McNerney votes aye. Mr. Braley. Mr. Welsh. Mr. Welsh votes no. Mr. Lujan. Mr. Lujan votes no. Mr. Tonko. Mr. Tonko votes no. Mr. Yarmouth. Chairman Upton.
Votes aye.
Chairman Upton votes aye.
Other members wishing to cast a vote? Mr. Braley.
Mr. Braley votes aye.
Ms. DeGette. How's Ms. DeGette recorded?
Ms. DeGette is voted as aye. Ms. DeGette votes no.
Mr. Sarbanes.
Mr. Sarbanes votes aye.
Mr. Butterfield.
Mr. Butterfield votes no.
Other members wishing to cast a vote? I'm sorry, what?
Ms. Elmers.
Ms. Elmers?
Ms. Elmers votes aye.
Mrs. Capps, is she recorded?
No, she is not. Mrs. Capps votes no. Dr. Cassidy? Dr. Cassidy votes aye.
Other members wishing to cast a vote? Mr. Sarbanes?
Aye. Mr. Sarbanes votes no.
All right. Other members? Seeing none, clerk will report the tally. How is Mr. Hall?
Mr. Hall votes aye.
And Mr. Yarmouth, is he recorded?
Mr. Yarmouth? Mr. Yarmouth votes no. Mr. Chairman, on that vote, there were 31 ayes and 11 nays.
31 ayes, 11 nays. The bill is favorably reported. The chair would now call up H.R. 5214 and ask the clerk to report.
H.R. 5214 to require the Secretary of Health and Human Services to provide for recommendations for the development and use of clinical data registries for the improvement of patient care.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point. There any so ordered? Chair would recognize Mr. Olson to offer an amendment in the nature of a substitute.
Mr. Chairman, I have an amendment at the desk.
Clerk report the title.
Amendment in the nature of a substitute to H.R. 5214 offered by Mr. Olson of Texas.
And without objection, the reading of the amendment is dispensed with. The gentleman is recognized for 5 minutes in support of his amendment.
Thank you, Mr. Chairman. This amendment makes a few corrections to the bill, but the goal of H.R. 5214 is still the same: transparency from HHS. It ensures that patients and other groups are consulted along with health providers when forming a registry. It makes it clear the bill gives no new powers to the Secretary. It cannot be used to mess with the practice of medicine. I'd like to yield some time to Chairman Pitts for a few comments and introduction of some documents.
Chair, thanks the gentleman. I want to commend my colleague, Mr. Coulson, for his leadership on this bill today. As we all know, because of our work on the SGR and other issues, registries have the potential to transform our health care system and the quality of care that patients receive in this country. Unfortunately, CMS has been creating numerous barriers and hardships on providers and patients seeking to harness the potential of such registries. And that is why Mr. Olson's legislation is so timely and so very important. The bill enjoys widespread bipartisan support from patients, providers, and senior organizations who have years of experience in building and operating clinical registries, including the American Association of Neurological Surgeons, the American Academy of Ophthalmology, the American Academy of Orthopedic Surgeons, the American College of Emergency Physicians, the American College of Gastroenterology, the American College of Surgeons, the American Gastroenterological Association, the American Joint Replacement Registry, the American Society of Anesthesiologists, the American Society of Clinical Oncology, the American Society of Nuclear Cardiology, the American Society of Plastic Surgeons, the American Society for Radiation Oncology, the American Urological Association, the North American Spine Society, the Society for Vascular Surgery, the Society for Interventional Radiology, the Society of Neurointerventional Surgery, the Society of Thoracic Surgeon, the American Association of Clinical Endocrinologists, the Global Genes Project, Little Miss Hannah Foundation, Mary Peyton's Miracle Foundation, Parent Project Muscular Dystrophy, the San Filippo Foundation for Children, the Association of Mature American Citizens, Taylor's Tale, Drew's Hope, You Are Our Hope, and I ask unanimous consent to have these letters of support entered into the record.
Without objection.
I yield back.
I
Yield
thank my
back.
friend from Pennsylvania and yield back the balance of my time.
Gentleman yields back. Chair would recognize, strike the last word, Mr. Pallone from New Jersey for 5 minutes.
Thank you, Mr. Chairman. Again, I object to the fact that we have not had regular order in the subcommittee on this bill. In fact, this bill wasn't even introduced until Monday night, and there has not been a real opportunity to review this bill. I know my chairman of the subcommittee says that it's bipartisan. I don't think it's bipartisan. It's just another example of where, you know, we're getting a bill. We haven't had an opportunity to have a hearing, to have a markup in subcommittee. And that's not a good thing, because this thing could be bipartisan if the Republicans were willing to cooperate with us. We all agree that registries are a good thing. In fact, they were a big part of the discussion during the SGR process, and we remain committed to our efforts to enact those registry provisions along with the SGR bill. But this new bill appears to duplicate current public-private efforts that are already in existence. Both the AMA, through the National Quality Registry Network, and the Agency for Healthcare Quality Research, through its extensive public-private registry user guide, have already done exactly what this bill appears to be seeking to do, and that is provide detailed information on how to establish, operate, and use registries for quality improvement and outcomes improvement. The problem isn't that provider organizations don't know how to set up a registry. The real problem is a lack of funding. And that's why the bipartisan SGR bill included provisions that would incentivize the development and use of registries. There's no reason a committee bill on registries couldn't be bipartisan. But I can't support a bill that adds more bureaucracy and duplicates what's already out there. Rather than marking up this bill, which again did not go through regular order, did not have a subcommittee hearing or markup, our time would be better spent drafting a bipartisan bill over the August recess that provides a small amount of seed grant money for registry development and technical assistance. The knowledge on registries is out there, and groups just need the funding to execute it. And I believe that would be a much better and a more productive path to take. Again, I don't understand why there's such an effort to move this without having the opportunity to really look at it and what it's going to mean. That's why you have hearings in subcommittee, which we're not having. So again, I'm going to ask for a recorded vote on this, because I think that this is something that could have been bipartisan, but that opportunity has been basically rejected by the Republicans here today, Mr. Chairman. I yield back.
Chairman yields back. Other members wishing to speak on the bill? Seeing none, are there any other amendments? So I guess are there any amendments to the amendment in the nature of the substitute? Seeing none, the vote occurs on the Olson amendment in the nature of a substitute. All those in favor of the amendment will say aye. Aye. Those opposed say no. Opinion Chair, the ayes have it. The ayes have it.
Mr. Chairman, are we voting on
the amendment?
On the amendment, okay. I'd ask
The
for a
amendment
recorded
in the
vote on
nature
the
of
bill.
is adopted. Are there further amendments to the bill? See none, the vote occurs on H.R. 5214 as amended, and the clerk will call the roll.
Mr. Hall. Mr. Hall votes aye. Mr. Barton. Mr. Barton votes aye. Mr. Whitfield. Mr. Shimkus. Mr. Shimkus votes aye. Mr. Pitts. Mr. Pitts votes aye. Mr. Walden. Mr. Walden votes aye. Mr. Terry. Mr. Terry votes aye. Mr. Rogers. Mr. Murphy. Mr. Murphy votes aye. Mr. Burgess. Mr. Burgess votes aye. Mrs. Blackburn. Mrs. Blackburn votes aye. Mr. Gingrey. Mr. Gingrey votes aye. Mr. Scalise. Mr. Latta. Mr. Latta votes aye. Mrs. McMorris Rogers. Mr. Harper. Mr. Harper votes aye. Mr. Lance. Mr. Lance votes aye. Mr. Cassidy. Mr. Cassidy votes aye. Mr. Guthrie. Mr. Guthrie votes aye. Mr. Olson. Mr. Olson votes aye. Mr. McKinley. Mr. McKinley votes aye. Mr. Gardner. Mr. Pompeo. Mr. Kinzinger. Mr. Kinzinger votes aye. Mr. Griffith. Mr. Griffith votes aye. Mr. Billrakis. Mr. Billrakis votes aye. Mr. Johnson. Mr. Johnson votes aye. Mr. Long. Mr. Long votes aye. Mrs. Elmers. Mr. Waxman. Mr. Waxman votes no. Mr. Dingle. Mr. Pallone. Mr. Pallone votes no. Mr. Rush. Ms. Eshoo. Mr. Engel. Mr. Engel votes no. Mr. Green. Mr. Green votes no. Ms. DeGette. Ms. DeGette votes no. Mrs. Capps. Mrs. Capps votes no. Mr. Doyle. Mr. Doyle votes no. Ms. Schakowsky. Mr. Matheson. Mr. Matheson votes no. Mr. Butterfield. Mr. Butterfield votes no. Mr. Barrow. Mr. Barrow votes no. Ms. Matsui. Ms. Christensen. Ms. Castor. Ms. Castor votes no. Mr. Sarbanes. Mr. Sarbanes votes no. Mr. McNerney. Mr. McNerney votes no. Mr. Braley. Mr. Welch. Mr. Welch votes no. Mr. Lujan. Mr. Lujan votes no. Mr. Tonko. Mr. Tonko votes no. Mr. Yarmouth. Mr. Yarmouth votes no. Chairman Upton.
Votes aye.
Chairman Upton votes aye.
How does Mr. Braley vote? Mr. Braley votes aye. Other members, Mr. Gardner.
Mr. Gardner votes aye.
Ms. Eshoo.
You are not recorded. Ms. Eshoo votes no.
Other members wishing to cast a vote? Seeing none, the clerk will report the tally.
Mr. Chairman, on that vote, there were 25 ayes and 18 nays.
25 ayes, 18 nays. The bill is favorably reported. Chair will now call up H.R. 4701 and ask the clerk to report.
H.R. 4701 to provide for scientific frameworks with respect to vector-borne diseases.
Without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point, so ordered. And the chair would recognize Mr. Pitts to offer an amendment in the nature of a substitute. Okay.
Mr. Chairman, there's an amendment at the desk.
Clerk report the title of the amendment.
Amendment in the nature of a substitute to H.R. 4701 offered by Mr. Pitts.
And the amendment will be considered as read. The staff will distribute the amendment, and the gentleman from Pennsylvania will be recognized for 5 minutes in support of his amendment.
Thank you, Mr. Chairman. H.R. 4701, the Tick-borne Disease Research, Accountability, and Transparency Act of 2014, authored by Mr. Gibson, is an important bill to address the growing threat of Lyme disease. This amendment would make important changes to ensure transparency and public input into the process. We've received important feedback on this bill and look forward to continuing the dialogue with the minority, the patient groups, the medical groups, and others as we move to the House floor. With that, I yield back.
Mr. Chairman.
Does the gentleman yield back? Gentleman yields back. Chair would recognize the gentleman from New Jersey, Mr. Pallone.
Thank you, Mr. Chairman. I continue to have concerns that language in the Pitts Amendment could jeopardize the ability of HHS to make decisions grounded in the strong science that should inform public health policy. The Pitts Amendment would have the Speaker of the House of Representatives and the majority leader of the Senate appoint members to the working group on Lyme disease and other tick-borne diseases. Congressional appointments to a standing committee that will be advising the Department on interagency coordination and research priorities could be seen as an attempt to allow Congress to politicize the research process. I would want to see all congressional appointments to the working group removed in order to fully endorse this bill. The language regarding working group members who represent a diversity of scientific perspectives and requiring the working group's report to Congress to include views that are not supported by the working group as a whole is also concerning. Leading public health groups, including the American Public Health Association, the Association of State and Territorial Health Officials, the National Association of County and City Health Officials, and the Trust for America's Health, recently sent a letter to committee leadership expressing concerns that this language could mandate the inclusion of perspectives supporting the long-term use of antibiotics for the treatment of Lyme disease. I'd ask unanimous consent, Mr. Chairman, to submit that letter into the record for today's proceedings.
Without objection.
Now, according to the National Institute of Allergy and Infectious Disease, a short course of antibiotics cures the majority of cases, and more complicated cases can usually be treated with 3 to 4 weeks of antibiotic therapy. But for patients reporting continued symptoms after this antibiotic treatment, studies have shown that additional antibiotic therapy is not beneficial and its risks outweigh the benefits. The overuse of antibiotics and antibiotic resistance are public health threats that this committee should take seriously. I think that we can all agree that Lyme disease is a concerning health issue. The CDC estimates there are approximately 300,000 nationwide Lyme disease cases each year, and I support ensuring that research in the area of Lyme disease is productive and significant. However, there are still a number of other changes that I would like to see made to this bill, changes that have already been communicated to committee staff. I don't want to prevent the bill from advancing today, but before this bill moves to the floor, it is important to me that these concerns be addressed. And so, Mr. Chairman, I hope that I have your commitment that you and your staff will work to address them before we go to the floor.
Would the gentleman yield?
Certainly.
And I know Mr. Griffith is going to ask for his own time. I just want to tell both of you and others, this is an issue that all of us care about. There has been a huge uptick in the number of incidents. I have to believe that all of us know a family with a member that's impacted by this, a whole series of just awful illness, and we want to address it, and we want to make things much better. And I give you my commitment, and I know that we've worked over the last couple of months working with Republicans and Democrats to try and get a bill that actually does something, that moves the research forward, that will give hope to families out there. And I give you my absolute commitment that we will continue to work together. This bill obviously won't be scheduled, until September at the earliest, maybe after the election, who knows. But we have an opportunity. I would guess that it'll go up under suspension of the rules. We have an opportunity to offer Chairman's amendment to that. That's part of the rules, and I look forward to working with all parties to continue to try and make this a better bill. And with that, I yield back to my friend.
Thank you, Mr. Chairman. I appreciate that, and I yield back.
Would recognize the gentleman from Virginia, Mr. Griffith, for 5 minutes.
Thank you very much, Mr. Chairman. I think this is a good bill, and I have an amendment that is currently at the desk. However, I'm going to ask that it not be offered, but I am going to talk about it for a minute. A lot of groups worked on this bill, and I know that the Lyme community, those who are trying to make sure that we get a bill that does something, and as you said, Mr. Chairman, it is an important issue and something that we need to take action on, have agreed to this language. But I am disturbed by the trend in Congress over the last 50 or 60 years to, for some reason, take away our prerogatives and hand it over to the administrative branch of government. It doesn't matter whether it's a Democrat administrative branch of government or executive. It doesn't matter if it's a Republican. We need to start looking out for the prerogatives of the United States House of Representatives because it's the people's house. We're the closest representatives to the people of the United States. We're the ones they come to first to complain about issues, and so we have a responsibility to try to do that. As a result, my amendment would have taken the currently one member appointed by the Speaker of the House and one member appointed by the Majority Leader of the Senate and made it 2 members, because I believe as we go forward, we need to work very hard to make sure that we are an equal partner with the executive branch when it comes to making policy on this issue and many others. And so, Mr. Chairman, I just want to say I know that Mr. Pallone and I disagree on this, and that's what legislative bodies are supposed to do, have discussion, have disagreement, try to work it out. I'm not going to introduce the amendment that would have changed it from a total of 2 legislative appointments to 4, but I think we as a House, Democrats and Republicans, representing our respective peoples, need to realize that on a lot of these commissions, we need to have somebody there who answers to the people's house, who says, okay, this is what's going on, because whether it's a Democrat president, whether it's a Republican president, doesn't really matter. We have a job to do as the people who represent the United States of America in the people's house. And with that, Mr. Chairman, I yield back.
Chairman yields back. Are there other members wishing to speak on the amendment? Seeing none, the vote occurs on the Pitts amendment in the nature of a substitute. All those in favor will say aye. Aye. All those opposed say no. Opinion of the chair, the ayes have it. The amendment in the nature of a substitute is adopted. The vote now occurs on the bill as amended. All those in favor will say aye. Aye. All those opposed say no. Opinion of the chair, the ayes have it. The ayes have it. The bill as amended is agreed to. Chair now calls up the last bill of the markup, H.R. 3522, and asks the clerk to report.
H.R. 3522 to authorize health insurance issuers to continue to offer for sale current group health insurance coverage in satisfaction of the minimum essential health insurance coverage requirement and for other purposes.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point. So ordered. Are there any amendments to the bill? Seeing none. Oh,
I have
no. Just strike the last word. Gentleman from California is recognized for 5 minutes.
Thank you, Mr. Chairman. Republicans have long claimed that the ACA would destroy millions of jobs and would cause tens of millions of Americans to lose their employer coverage. Here's what has actually happened. Since the law was enacted, businesses have added nearly 10 million jobs, and in just the past few months, more than 10 million people who were previously uninsured have gained health insurance coverage. And yet my Republican colleagues still insist the ACA is creating calamity in employer-sponsored health insurance. That is where H.R. 3352 comes in. The legislation that's before us would allow insurance companies to discriminate against small businesses if they have an older workforce, more women in their workforce, or if any of their employees or their children have pre-existing health conditions. Under the legislation, these small businesses would face higher premiums and would continue to see their premiums spike year to year if an employee had an accident, developed a chronic health condition, or had a complicated pregnancies. Republicans are claiming that this is just an effort to help people keep the coverage they have. But let's be clear. If your insurance starts covering your child to the age of 26, you are not losing your old coverage. Your coverage is simply getting better. If your insurance starts covering preventive services like annual physicals and vaccinations and cancer screening for free, that's not losing your old coverage. That is a sign that your coverage is getting better. But that is not what the Republicans are arguing. They're arguing something that for which there is no evidence. Employers are dropping coverage en masse, they say. So Republicans are left to claim people are losing their coverage when their coverage is actually getting better. That's misleading, and that's why I oppose this bill. We ought to let the ACA go fully into effect and not leave these policies that are not fully covering them in place. So I urge opposition to the bill and yield my time back.
Gentleman yields back. Chair would recognize the gentleman from Louisiana, Mr. Cassidy. Dr. Cassidy.
Thank you. Well, first, let's put a point on it. The President and the supporters of Obamacare promised numerous times that if you like your health care plan, you can keep it. It was unequivocal, and this unequivocal promise was apparently necessary, they thought, to pass Obamacare on one of the slimmest, most partisan votes in congressional history. But it was clear to anyone who actually read the bill that the promise was false and it would be a major disruption in people's health care plans. And we now know it was a false problem. For example, 93,000 people in Louisiana have lost their health care plan due to Obamacare. Now, the President has acknowledged this was a false promise. When asked in an interview about those who had their health coverage canceled due to Obamacare, he goes, well, I'm sorry they're finding themselves in this situation based upon assurances they got from me. And Mr. Chairman, I have an article to this effect that I'll submit for the record. Yet even after the acknowledgement of the President, congressional supporters continue to defend the promise. For example, when asked about the President's apology, Ms. Pelosi said he is gracious, he's taken responsibility, but that doesn't mean there was anything in the law that said that what you had before 2010, you couldn't keep it. Now, Mr. Chairman, I have another article I'll submit for that. Now, this is after millions of Americans, and I laugh kind of grimly, had their health care coverage canceled because of Obamacare. Now, by the way, as Mr. Waxman brings up, extols the benefits of this, you know the shop exchanges in 18 states will have only one offering. Only in 18 states there will only be one plan that you can take or leave. Recent reports that the average increases in the small group market will be 11%. In some states, 10 times that much. Forbes recently reported that in Washington State, the increase for small businesses was going to be 588%. Wow. Man, we've done them a favor, huh? Pennsylvania is going to be 66%, California 37%. Now, a similar bill was introduced by Chairman Upton for the individual market and received 44 votes from Democrats. There are some, I think, who are less interested in protecting the signature legislation of President Obama and more interested in actually protecting American workers getting hammered by premium increases. My legislation, the Employee Health Care Protection Act, is meant to do one thing: provide relief to American workers and ensure that the American people can keep the health care plans they like. If supporters of this law really believe in keeping their word to the American people, they should support this legislation. It'll allow millions of Americans to keep the health care plan they like. If they don't like it, they can go onto the exchange. We don't have to kind of benignly say that you are better off with what we're telling you you're better off with. Let them choose. And if they like to have the plan that's only a shop exchange, the one plan in some cases, they can join it. And if they choose not, they can stay with the plan that they do. For whatever reason, I think giving the American people the power of choice and keeping promises made is a better alternative. Mr. Chairman, I yield back.
Gentleman yields back. Gentleman from New Jersey.
You know, I listened to the sponsor, and I do respect him, but I just don't understand this theory about wanting to have the freedom to choose a lousy plan. I just don't get it. I had this conversation once with Ms. Fox at the Rules Committee, where she told me that she had a constituent who wanted to keep their plan, and I asked what the plan was. And it was you paid $50 a month, and you got no hospitalization. And I said to her, I said, you know, what good is an insurance plan if it doesn't cover hospitalization? Because my whole, you know, most people when they're looking for health insurance want to at least provide coverage for hospitalization so they don't spend $100,000 or $200,000 when they have to go to the hospital. But the gentleman and the GOP continue this charade that somehow freedom means the freedom to have a lousy health plan that doesn't even include hospitalization. And people buy these $50 plans and don't realize that they don't include hospitalization. And that's what the gentleman is continuing here. I know that was the individual market. He's talking about the small group market. But it's the same thing. The Republicans are claiming that H.R. 3352 was essential so that people can keep the plans they had and they liked in 2013. But let's get the facts straight. When the law passed, employers and health insurers had the option to grandfather their coverage. They could keep that coverage the same, and it would not have to comply with the new ACA reforms. They could even raise premiums and cost sharing and still stay grandfathered. For plans that did not grandfather, a host of important new consumer protections went into place that are very important. Plans had to limit their profits and overhead to 20% of the premiums they collect. Plans had to offer free preventive care and get rid of lifetime limits on coverage. In November of 2013, the President announced that individuals and small businesses who were not yet ready to transition into these new, more fair, secure health coverage guaranteed by the ACA could remain in their existing plans for another year. And then in March of this year, the President extended that policy so that individuals and small businesses could keep their plans into 2016. But this bill would allow those 2013 plans to stay on the market forever. And people who didn't even have those plans could now buy into them. And that means consumers don't get the new protections that went into effect this year. I don't see how that's good policy. Just repeating, that you should be able to have the freedom to keep these lousy plans is not what we should be talking about here. We should be talking about how we provide good coverage for the average American. And since the ACA was passed, we've added key new benefits and protections to employer coverage, but at the same time, we've added 10 million jobs. We've helped 10 million people to get health coverage. We've seen premiums rise at historically low levels, and we've extended the life of the Medicare Trust Fund by 13 years. That just came out this week. This is amazing progress, and we shouldn't turn back just because someone thinks that I should have the freedom to buy a lousy health plan that may not even include hospitalization. I don't think that's the freedom or the choice that the framers intended. We're supposed to be acting for the public good here, in my opinion. I would yield, yes.
I also want to point out that when people make this choice to stay on a plan that doesn't have the protections of the ACA because they think they won't get sick, they're taken out of the pool of the insurance group that would be paying for everybody else in the marketplace. And that means we're continuing to segment the market and shifting the costs onto other people. So thank you for yielding.
Thank you. I would yield back.
Chairman yields back. Chair would recognize Mr. Barton from Texas.
Thank you, Mr. Chairman. Before I talk about this issue, I just want to say that I associate myself with what Congressman Griffith of Virginia said about the need for the Congress to reassert itself. While he didn't ask for a vote on his amendment, I would have voted for it, and I hope that he continues that fight. On this issue, it is ironic to me to hear my friends in the minority continue to use the talking points that they used when they were passing the Affordable Care Act and act as if there have been no intervening events in the real world. They got exactly what they wanted. They crammed it down our throats in this committee, on the floor, in the Senate, and the President signed it. It's not working. It is not working. The President's plan, or the Affordable Care Act's disapproval rating in the country today stands around 60%. And that's a reality. It doesn't matter what the talking points say. And the bill before us gives people a real choice. Now, I will agree with Mr. Pallone and Mr. Waxman that some of the older plans are not as extensive and they don't offer as much coverage. And I don't know how you define good, but perhaps they're not as good as the mandates in the Affordable Care Act. But they do have one advantage. They are affordable. And some people prefer less coverage rather than more coverage. And why should we prevent that from happening? Just because liberal ideology says you have to accept this as the best coverage doesn't mean that it is. I get letters every day in my congressional office from people who signed up for Obamacare, and now they can't afford it, or it's not available, or there is some problem with it. So don't let the perfect be the enemy of the possible. Some coverage is preferable to perfect coverage that you can't afford or don't need. And that's what the bill before us attempts to do, allow some semblance of private choice, private markets to continue to operate. There is nothing wrong with that principle. The Affordable Care Act is not going to work. It will eventually either be changed or it will be repealed and replaced. And this bill before the committee is simply a minor step, but an important step in that process. And with that,
will the gentleman yield?
I'll yield to Mr. Shimkus and then Dr. Gingrich.
Yeah, and I'll be brief too. Most people, when I talk in my congressional district, will accept the premise that health insurance across the board, people are paying more and getting less. I say that all the time. They concur. Co-pays are up, premiums are up, and when you have a perfect policy and people go to the hospital and they can't pay the co-pay, then the hospital has uncompensated care, which they were promised they wouldn't have to have, because they can't even make the minimum payments required under these new perfect plans. So it's really kind of speaking to Joe's debate. And this is just a basic difference between the ideologies of the two parties. We believe in the power of the individual and having choice. The health care law was a perfect example of government knowing best and depriving individuals from the freedom of choice to make their own decisions and let them be held accountable. And with that, I want to thank you for your time.
48 seconds to Dr. Gingrich.
Well, I thank the gentleman for yielding. You know, I've heard a member on the Democratic side say just a few seconds ago that he can't believe that Republicans are defending the right of an individual to buy a lousy plan. You know, years ago I bought a Ford Maverick, and everybody told me it was a lousy car. Maybe it was, but it got me from point A to point B, and it was what I could afford. It was the automobile that I could afford. And that's kind of following on to what Representative Barton said. I mean, that's what America's all about, our rights to choose. And I'm so surprised that our colleagues on the other side of the aisle think that a one-size-fits-all, whether you can afford it or not, is a way to go dictated by the federal government. No, an individual ought to have the right to buy a lousy plan. I don't think they are lousy plans. I think they're good plans, and I yield back.
Gentleman's time has expired. The chair would recognize the gentlelady from California, Ms. Eshoo.
Thank you, Mr. Chairman. I move to strike the last word. I don't know how many of you recall years ago on Saturday Night Live, there was a segment entitled The Whiners. And, you know, they sat on the sofa and all they did was whine. They were a broken record. And I can't help but think of that segment of Saturday Night Live. You know, the first rhetorical question that I would raise is, what do you have on the table? What plan have you come up with for the American people that would end the discrimination that we ended in the Affordable Care Act and all of the benefits that have come with it? It's a broken record. It's a broken record on your side. And it really, again, all of a sudden, I can picture and hear that segment on Saturday Night Live. You hate the health plan, the person that signed it into law, and it's been a constant drumbeat. And now you're suing the president for making an adjustment. I mean, go figure. With taxpayer dollars, I might add. All of those that are beat their chest about being fiscally responsible. Now, I think that these benefits that come in the package as a result of reforming the insurance industry. People care a great deal about that. People getting sick and then being dropped, you think that that's a good policy? Why don't you write a policy like that into law? See how many people would stand next to you on that. There's a portion of the ACA that I learned about years ago, introducing legislation in the mid-90s. And I learned this from the disabilities community. They would reach the cap, the ceiling, the limit on their health plan. And then, guess what? Go fishing. You have nothing because you've reached that ceiling. And reintroduce that legislation, one Congress after another, and then it finally made its way into the ACA. These are things that people care about. They didn't have choice before because they were discriminated against. So where is your plan? It's either your plan is no plan. Your plan is whining. Your plan is suing the president and using taxpayer dollars. Now, come on. You know, we're passing some good legislation out of the committee today, and you know what? This committee is just too important to be taking up what the whiners did on Saturday Night Live years ago. So this is, if we want to talk about a lousy plan, this one is the one that's before us. I'm sorry to say that, but it is. And it's unfair to the American people. And you pull a veil over it and do a dance and say, this is attractive. Come on down. Except any reform that we passed to protect the American people against what the insurance companies were doing is stripped out of it all over again. So what year and what century do you want to go back to? America is all about moving forward, not looking in the rearview mirror and thinking you see the past. What you have on the table here is part of the past. You want to stick with that, stick with it. But I don't think the American people are with you on this at all. I really don't. Is the ACA perfect? Of course not. No legislation is. Why? Because it's the product of human beings. We are all less than perfect. But when you start talking about how they were discriminated against by the insurance companies, I want to tell you that I don't believe that in any of your districts that your constituents are saying, bring it on. We love having a choice to be discriminated against. I mean, I just don't fall for that. So I think we should just get this thing off the table. And I don't know why you think this is a good idea. Let's take a vote on it. And I hope no more Saturday Night Live whining is brought up in legislation, because it's not attractive, it's not truthful, and it really does not fit with the dignity of the American people. I yield back.
Ladies' time has expired. Chair would recognize the gentlelady from Tennessee, Ms. Blackburn.
Thank you so much, Mr. Chairman. I am enjoying this debate that we are having this morning. You know, I think that the gentlelady from California and the colleagues on our left may appreciate knowing Gallup did a poll in May. Ask the American people that were surveyed, what's the biggest problem with the federal government? What's your greatest fear of what is wrong with our country? What do you think is wrong? Over 75% of the people surveyed said that the biggest fear they have about what's going on in this country is that big government, taking too much of their freedom, interfering with their lives. And guess what? 56% of all Democrats that were surveyed said big government is the biggest problem we have. Why do they feel this way? It's because, primarily, the impact of the Affordable Care Act, or PAPACA, or Obamacare, whatever you want to call it, and it is reaching in, it is taking their freedom, it is taking away choice, it is taking away options, and it is saying, you must do this and handle your health care, which is a personal matter, in this way because the federal government says you're going to do it this way. Now, it is never whining to stand up and fight for freedom. And I would seriously doubt that Patrick Henry ever said, give me health care or give me death. He said, give me liberty or give me death. Health care is something where individuals want to make their choice of what is going to work for them and what is going to work for their families and purchase a plan that they can afford. Mr. Cassidy is to be commended for bringing the bill forward that stands with the majority of Americans who say Obamacare is not working for them. It is too expensive to afford. The networks are narrowing, the out-of-pocket costs are rising, and the American people do not see this as a resolution to any health care issues that they are facing. With that, I yield to the gentleman from Colorado.
I thank the gentlelady for yielding, and I wish I had brought some of the letters with me from Coloradans who had their health insurance canceled. 335,000 Coloradans had their health insurance canceled thanks to Obamacare. They're not whiners. They're not some whiners on Saturday Night Live. I think it's offensive to call the 335,000 people in Colorado who had their health insurance canceled nothing but Saturday Night Live whiners. I hope that this debate will take a higher cause and higher purpose than to focus on people in Colorado who had legitimate health care needs and concerns and policies that they wanted to keep, and to call them whiners. But perhaps that's what some people in this chamber and body think they are. Nothing but whiners. 335,000 Coloradans, millions of people around this country, just whiners, because they bought health insurance plans they were promised they could keep. Let's go back to those talking points. Let's do a little rewind and replay of the talking points from several years ago. If you like your health care plan, you can keep it. Lie of the year. If you like your doctor, you can keep him or her. Turning out not to be true. And in the debate today, it's talked about how premiums are rising. Admitting that premiums are rising. But the promise of Obamacare was that it would lower premiums. And so here we are, having a fight over a bill that the majority of the American public has rejected, with people calling millions of Americans whiners. I support this legislation and believe that people ought to be given the choice to keep the plan that they liked, that they wanted to keep, that worked for them. And who are we? Who are we as Congress to think we know what's best for the people of this country? And that we can impose our judgment on them because we believe we are smarter than them. Shame on anyone here who believes that the people of this country are whiners. Mr. Chairman, I urge the support of this bill and yield back to the gentlelady.
I thank the gentleman for yielding back, and I yield my time back to the chairman.
Gentlelady yields back. Other members wishing to speak, I see a lot. Mr. Green, recognized for 5 minutes.
Thank you, Mr. Chairman. I know in the news, if you look at the news today, we're all talking about ceasefires. I've enjoyed the last ceasefire for about the last 3 or 4 months, that we haven't had a motion on the floor to repeal the Affordable Care Act, because we've actually been working on issues in the committee that may have an impact. But again, bringing this bill up, it reminds me of the same arguments that I think some of us may have heard in the 1960s after Medicare was passed, although Medicare passed with Republican votes, unlike the Affordable Care Act. But I remember seeing things in the 60s talking about how it was so terrible, socialized medicine. And yet, I bet you there would not be one person today in Congress who would get up on the floor and say, let's abolish Medicare and let's let people have their liberty not to have insurance over 65 or let them die, because that's what we're talking about. That's the liberty and death we're talking about. The discussion today, it's just so incorrect, and I want to ask unanimous consent to place into the record 2 items about how misleading some of this information is on the Affordable Care Act. First, it's an article from National Journal titled, "Obamacare Premiums Aren't Living Up to the Sayers' predictions. It shows how premiums are growing at a slower rate than they have in the past. In fact, premiums are actually falling in many states around the country. The second document is issue brief from the Department of Health and Human Services showing the actual premium people in marketplace plans pay only $82 a month. And financial is assistance available for the vast majority of the consumers, and that is saving people real money. If I could ask unanimous consent to place that in the record, Mr. Chairman.
Without objection.
Mr. Chairman.
Well, thank you. I still have, it'd be nice just to legislate. And I think that's what the Energy and Commerce Committee has been. Our history is to legislate. And so instead of having the 54th or 56th or 57th time that we'll have something on the floor to repeal the Affordable Care Act, let's see if we can fix the law. There has never been a law passed by any Congress that's perfect. And if you want to fix it, if you have complaints about the problems, let's sit down and work it out. But just repealing it is not going to happen, and it'd be nice not to, not to have this battle again because we've already had it. I think 53. I know some Republicans say 56 times, and I like to yield the remainder of my time to my colleague from New Jersey, our ranking member on health care.
I just want thank you, and I just wanted to go back to my example before rules with Virginia Fox, where Congresswoman Fox, where she said, you should have the freedom to have this $50 plan. You pay $50 a month, you don't get hospitalization. The problem, though, is it's all very nice to talk in an ideological sense about how that's choice and that's freedom, and we can talk about Patrick Henry, and, that's wonderful. But the problem is when that woman ends up in an accident and she goes to the hospital and she runs up a bill for $100,000 or $200,000, first of all, she may not even realize that her plan for $50 doesn't have hospitalization because they don't necessarily tell her that. And then the other thing is that $100,000 or $200,000 ends up being passed on to everybody else. So you may think of this in this ideological sense of how wonderful it is to have the freedom to have a lousy plan, but a lot of people don't even realize that that's what they're buying. And the consequences for the healthcare system and for everybody else is that their freedom becomes our responsibility. And I don't see how that's fair or how that's good policy. I yield back to Mr. Green. I don't know if anybody else wants your time.
Anyone? Okay. I yield to my colleague from Maryland.
Yeah, I just want to pick up on Ranking Member Palome's observation because to be logically consistent in arguing that you should be able to buy a quote bad plan or lousy plan that allows you to show up in the emergency room and be covered, you'd have to enforce basically a restriction against those people that they cannot use the emergency room. That's the only way it makes sense to say that somebody should have the liberty and freedom to choose a bad plan. Fine if they want to do that, but then you have to make sure they're not going to come consume resources that affect everybody else. Thank God we live in a country where we're not going to leave somebody in the gutter outside of the emergency room. We're going to bring them in, we're going to give them that coverage, and we're going to find a way to pay for it. But that's the reason that we need to have insurance in place broadly across the country so that those kinds of costs are covered. And so it's fine to take that position, but if you're going to take that position, be logically consistent about it, which you haven't been, and I yield back.
Gentleman's time has expired. Other members wishing to speak on the amendment? Dr. Murphy.
I think I moved to strike the last word. I'm not sure how many members of this committee were here when we dealt with the Affordable Care Act, but I do remember that I think we had some 30 different amendments to the bill offered on this side of the aisle. And I also found that even those that happened to make it to the bill, they all managed to disappear on the way to the floor. And the bill, the final law had to be passed on Christmas Eve. So if it was so good, it still brings up the question of why there was not the bipartisan work there before, which has been pushed through. But I do want to deal with a number of facts and one of the reasons why this bill and this amendment are before us. We were promised that we would deal with the high number of ER visits, and they would be down. Actually, indications are they are not down. On our hearings and oversight and investigation subcommittee, when it was brought up that the costs were going up of plans, there was immediate denial. Plans have gone up in cost when you look at the deductibles and copays. The people of Pennsylvania have told me repeatedly that when they have a $6,000 deductible for an individual or $12,000 for a family, they cannot afford it. Not only does this affect follow-up appointments with primary care physicians, this also has greatly affected psychological and psychiatric care when people can't afford the care. They put it off. And that sort of thing is not acceptable in that area of mental health. We also had hearings that the website would work. And on that, that was dismissed as insignificant. Well, it would cost $1 billion. You could provide a lot of health care to people for that amount of money. It was dismissed as that maybe it's just the cost of doing business. We're also told that businesses would not cut insurance, but businesses have cut insurance. Businesses have also kept number of employees under 50 because they feel if they increase over 50, they can no longer afford it. We were told the reason we had to pass this law was that 45 million Americans were without insurance. And now we celebrate when 9 million Americans have signed up. By any measures, that's not good math. What is still lacking here is the issue of moving forward on reforming the system. To simply say that we ought to be offering some amendments and other changes is not appropriate because we have offered several bills. And like 300 plus other bills, they lie in the Senate because the majority leader there, I assume, does not want to bring up any vote for senators to vote on the health care bill before their election. Because he knows a lot of people don't want to run on the Affordable Care Act because they know how unpopular it is with their constituents. I hope someday this committee can work together to reform this health care system in a way that's really reformed. I think we still have serious problems with the affordability and the access to care, because that which you cannot afford is still not care. Not just the premiums, but the deductibles and co-pays are still awful. And if there's any other member that wants my time, I'll yield to them. Otherwise, I'll yield.
I'd like a half a minute of it.
Thank you.
Let's get on with this. We're called a broken record. My answer to that is there aren't any more broken records. I heard the governor of Wisconsin talking to his son, telling him, get a job, get a job. And he said, Dad, you sound like a broken record. His father told him, said, no, there aren't any broken records anymore. There aren't even any Victrolas. You may have a broken iPod. Come on, let's vote.
Other Republican members wishing to use this time? Go
Ms.
ahead.
Elmers, do you want my time?
Yes, I would like to use the time, and thank you to my colleagues. You know, my colleague from Pennsylvania brought up a very important point about the deductibles. You know, our colleagues across the aisle continuously talk about that they don't know what terrible health care plan they had and how they are using this against them when they end up in the emergency room and then find out that they're not going to be able to afford. Who is they? And this, again, this continuous idea that hospitals around this country would ever turn any individual away for health care. Yes, there has to be a way to pay for it. That's what hospital staff does. That's what our social services do. That's what our social workers do. They work with patients. And yes, we have to come up with affordable care. But, you know, we were given a promise. The American people were given a promise. If you like your health care plan, you can keep it. And today we're going to enforce that. We're going to pass this. And we're going to look to the American people, and we're going to work with the American people. And I hope our colleagues across the aisle to come up with affordable care for every American. And with that, I yield back my 5 seconds.
Gentleman's time has expired. Chair would recognize the gentlelady from Colorado, Ms. DeGette.
Thank you very much, Mr. Chairman. And I'm really sorry that my colleague from Colorado gave his statement and lobbed all of these numbers out and then left, because they're actually not exactly correct. He said that 335,000 Coloradoans had their... Oh, he's back. Excellent. Good, because I want you to hear this, Mr. Gardner. Mr. Gardner said that 335,000 Coloradoans had their insurance canceled, but in fact, they did receive the notices, but 96% of those people received offers of renewal, and in fact, most of those, a number of those people did renew their insurance. The reason they received those notices is because they didn't comply with the minimal requirements of the Affordable Care Act. And the reason the Affordable Care Act has minimum requirements is because a lot of Americans who were buying these low-cost insurance policies were in fact not getting the health care that they needed to be healthy or to have their children be healthy. But nonetheless, these folks have all been offered, 96% of them were offered renewals and many of them accepted. But here's the other thing about Colorado since the Affordable Care Act was passed. In Colorado, the uninsured, the number of uninsured in Colorado after we did our state exchange dropped by 7.5%. And so it went from 16.5% of Coloradoans who were uninsured to 9% of, to 7% of to 9% of Coloradoans who are uninsured. And the other thing that happened was people are finding that their insurance rates have either stayed the same or only gone up a little or gone down. In other words, the cost curve is starting to bend, and most people have better insurance than they had before. And so actually, the program is working for most Coloradoans. Nationally, what we have seen is we've seen 10 million more Americans enrolled in health insurance, and the insurance rates have dropped by quite a bit nationally, and we're going to see even more of that. But I want to end what I'm saying in talking about my friend Selena, who I went to visit last weekend. Selena is self-employed. She's 63 years old. She was able to get insurance on the exchange at a cheap rate because she's self-employed, and she went in for a routine mammogram where they found something. She was able to have early detection, early surgery, and I went over to visit at her house last week, and she said to me, Diana, I want you to call Mr. Obama, and I want you to thank him because I probably wouldn't be alive here today if it weren't for Obamacare. I want to yield the balance of my time now to Ms. Capps.
Thank you. And I want to agree with my colleague from Texas in that there is no bill that's perfect. But one of the things I did was to support extending people's existing plans last year. The truth is, however, that the Affordable Care Act, as we know in California, it's called Covered California, is an important step to fixing our broken health care system. There are fixes we need to make in terms to improve it. This bill certainly doesn't do that. It doesn't mean consumers can definitely keep their old care, old plan. It just gives insurance companies an exemption from their responsibility to their constituents or their consumers. It gives them all the power. We're going right back to the old way, giving them all the power, and in so doing, taking that power of choice and reliability away from consumers. I can't support this legislation. I know we could be doing some good, important work in fixing the Affordable Care Act because nothing is perfect as it's originally written. We need the experience of states like California that are beginning to implement it, and we can make the changes that will make it more cost-effective and more affordable, more accessible. But by repealing it, which in disguise this legislation is doing yet another time, we are just going back to the same old, as was said earlier, broken record. So I want to yield the balance of my time. Thank you.
And I yield back.
Generally yields back. Other members wishing to speak on the Mr. Olson is recognized. Strike.
I thank the chair. I yield the balance of my time to my friend from Louisiana, Mr. Cassidy.
Thank you for allowing me this. I am struck at the smirks when this issue speaks of whiners. The smirks of people who clearly are insensitive to the burden this law has placed upon many Americans. Here is a study showing that for women, 2013 to 14, average premium increases of 41%. Going up as high of 41% with different age ranges having 18, 28, and 37. If you're one of those folks who's lower income, not on a subsidy, and someone in Congress is calling you a whiner and smirking over the inside joke? I cannot believe that. Secondly, Mr. Green, you mentioned National Journal. Unfortunately, that article is a little old. Here, I submitted for the record this, which shows that health care premiums skyrocketing, not according to Price Waterhouse, which did that study, but to insurance brokers. In Delaware, up to 100%. California, 53%. So I've submitted this for the record, but now I'll submit something that came out on the record today, because we just heard about how wonderful cover California is doing. In 2014, consumers purchasing individual policies, granted it's individual, pay between 22 and 88% more for health insurance than they did last year. You're a family not on a subsidy paying over 10 to 15% of your income for insurance, and people are smirking in Congress calling you a whiner. And as regards the superiority of these policies relative to that which is in the free market, I'll submit this for the record. Kansas Town employees loses health care coverage due to Obamacare, more expensive, less generous, and Blue Cross Blue Shield said they wouldn't cover anyone unless they worked more than 30 hours. Therefore, part-time employees now lose their health coverage. This is the superiority of the exchange. Now, again, as to the Shangri-La of how wonderful Obamacare is, here's another article from National Journal. Is Obamacare living up to its pre-existing conditions promise? And the reality is no. The reality is that under the law as written in Florida, HIV patients are not getting the therapy that they wish because they've been priced out. Now, I'm a little curious. Mr. Pallone thinks it's quite all right for the president by executive order to override statute and delay implementation, but when we attempt by statute to do the same thing the president does by executive order, it becomes unfortunately untenable. I wish you had entered your amendment protecting the prerogative of Congress, Mr. Griffith. I also would have voted for it. Now, I can understand why folks on the other side of the aisle are defensive. In 2009, I wasn't on the committee then, but here's something for the record. 32 Democrats voted to kill a GOP amendment that explicitly allowed people to keep their current health care plans. Explicitly allowed. It was voted against. I guess we don't care about whiners. And lastly, for the effect upon the on the job market. As it turns out, there's 10,000 more jobs, but there's not 10,000 more people working, 10 million more people working. I've been looking at this, and the low-income worker has, and it's statistical, I can provide it for you, has had her hours decrease from 40 to 30 and is having to take second jobs. There's 10 million more jobs, but not 10 million more workers, and that has disproportionately affected the lowest quintile of workers. I can provide all that documentation. We are pounding the American people with this law, but folks up here smirk, calling them whiners. Well, I stand firmly on the side of those American people who are now insurance poor to fulfill a vision of another party that doesn't think they are smart enough to know the policy they should have. And just let's do away with one more red herring. This has nothing to do with having policies canceled. There's still an open enrollment period. If you don't like your policy, you can go into another. There's nothing to prevent people from learning. But if they're 55 years old, they may choose not to buy obstetrical benefits. And if they have 18-year-old children, they may choose not to have pediatric dentistry, which they are now being forced to pay for. Now, again, I stand with the whiners. I stand against those who smirk about them. I yield back.
Gentleman's time has expired. Other members wishing to speak on the amendment? Seeing none. No vote. I think, Mr. Dingle, would you like to strike the last word, Mr. Dingle? Gentleman from Michigan is recognized.
There was a fellow in baseball who one time said, "Deja vu all over again." And by golly, that's where we are right now. I want to express my affection and respect for my colleagues on the Republican side, but I do think it would be nice if they would recognize that ACA is now the law of the land. It's working. Senior citizens just saved $11 billion on health care and on Medicare and on medicines. That was a remarkable event. And all of the other problems that we used to have about seeing to it that people got the health care they needed are in large part being addressed under this legislation. Is it perfect? No. Last time we wrote some perfect legislation, Moses brought it down off Sinai, and he got mad and threw it down and broke the whole business. But the hard fact of the matter is that it's better. Kids are on their parents' plans. We're seeing that everybody has a better chance. We're now seeing that people who had been denied by pre-existing conditions can get health care now, which they couldn't previously. Strangely enough, the insurance companies supported all of this. Remarkable event. And they thought it made a pretty good idea. They also are making money providing insurance rather than playing games by trying to evade legitimate costs and things of that kind. If you look, you will find that where people have a chance to know what is happening to them, they're finding this is a pretty good thing from the standpoint of their personal economic views. You know, my Republican friends...
Mr. Chairman, could we have order in the
I was
committee?
a small boy.
I can't quite hear because of the discussion.
Chairman's correct.
When I was a small boy, I remember my Republican friends spent huge amounts of time attacking Social Security. And then finally, that particular bunch died off. And then when I sat in the chair and presided over the passage of Medicare, they started attacking Social Security again and started attacking Medicare. And we finally got Medicare to the point where now people are saying, don't let the government get its hands on my Medicare. And so we hear a lot of people who are running around protecting senior citizens from government intrusion into their Medicare. Now we have this legislation. And we invited our Republican colleagues to join us in the consideration of the legislation. Couldn't get a peep out of them. They wouldn't come in. They wouldn't help. They wouldn't have a thing to do with what it is we're doing.
Would the gentleman yield?
So my hope is that the Republicans will stop this business of trying to just take us back to those sad, grim old days when our senior citizens and when our health people didn't have health care because the insurance companies had practiced that kind of insurance salesmanship. So with affection to my Republicans and Republican friends, let's get down to the simple business of doing what we should be doing, legislate. Let's get this thing going. Let's see to it that we make it work. Give it a chance. This is a piece of legislation that's covering 350 million people. It's a huge piece of legislation. And it's going to be a terrible, terrible task to get it to work in the way that we need to have it work. But if it can be done, if we all get together and pull together. And so to my dear Republican friends, I say, let's stop this nonsensical fighting. Let's defeat this legislation. Let's go on and get down to the business of making the Affordable Care Act, in fact, work for the benefit of all of our people, so we can go home and say, we did something good for the country, instead of just being down here with this nasty, unpleasant wrangling that's continuously going on and bringing nothing but disrespect and opprobrium upon the Congress. So with affection and respect, let's quit this nonsense and let's get down to serious business. Thank you, Mr. Chairman.
I think we're ready to vote. Can we vote? Other members wishing to speak? Well, if you're gonna All right, I yield to the gentleman from Colorado.
Mr. Chairman, strike the last word. I think I did misstate the numbers from Colorado. There were 335,000 cancellations, but since March, there's been an additional 2,300 plus cancellations. So actually the number is now 237,000 people in Colorado who've had their health insurance canceled as a result of Obamacare. These policies were indeed canceled. We had a panel of insurance companies testify before us that those plans were canceled because of the health care bill. We had a panel of insurance executives testify that the law was written in such a way that even those that had been extended will be canceled because of the health care bill. And to talk about what's happening in Colorado, remember the promises, the three primary promises that were made of Obamacare. And most people who voted for the bill probably said the same thing. The three primary promises of Obamacare. If you like your health care plan, you can keep your health care plan. 337,000 Coloradans found that not to be true. If you like your doctor, you can keep your doctor. People across this country have found that not to be true. This will lower the cost of health care premiums. People who supported the health care bill in this committee today have said premiums are rising. The third primary promise, the foundational promises sold to the American people, simply not true. But instead, 337,000 Coloradans have been called whiners here today. Now, when it comes to what's happening to those who had their health insurance canceled in Colorado, we don't know, because I will read to you what a Denver Post article said several months ago, that the Colorado Division of Insurance is not even tracking what's happening to the people who had their insurance canceled. Here's the quote from the Denver Post: "But Colorado's insurance division is not tracking what happens to premiums as policyholders move to ACA-compliant plans, so it's not known how many people are facing premium hikes and how steep those increases are." The Colorado Health Insurance Exchange has already increased taxes by millions of dollars. It's over budget. There are problems with the budget. They don't know where the money's being spent. I encourage this committee to take a look at these exchanges and see what's happening. Because after 1 year, we don't know if they're going to be sustainable. In fact, some of them are already increasing taxes by millions of dollars. 337,000 Coloradans lost their health insurance, had it canceled because of Obamacare. Mr. Chairman, I yield back.
The gentleman.
I yield the time to gentleman from Texas.
Yeah, just briefly. This is a really important issue, and it's to the benefit and appreciation of the members that everybody takes it seriously. These are real issues, and this is a committee that's got a history of working on real issues. But it shouldn't get too personal. And when some of the things that have been said about whining and all of that, first of all, I thought Ms. Eshue's comment was cute. I thought it made a point. I didn't agree with the point. I also think that I'm one of the few members on the Republican side that can remember that. Most of our members over here are either too young or their parents wouldn't let them watch such trivial entertainment as Saturday Night Live. So I hope, in the spirit of what Mr. Dingell was talking about, and certainly in the spirit that Chairman Upton wants, that we talk about these issues, but in a friendly, non-personal way, because whatever side you're on this debate today, this committee will be involved when we make changes to the Affordable Care Act, and those changes will be made, and they need to be made in a legislative way. And that's what we're about today. Mr. Cassidy's bill is an honest attempt to do it in a more conservative way. And I understand people disagree with that, but that's what Congress is about. We'd rather be here calling each other whiners than shooting at each other like they're doing in other parts of the world. And I can assure my members on the majority side, I've been called a lot worse than a whiner in this committee. So that's a minor point. And with that, I yield back.
Chairman yields back. Other members wish to speak? Mr. Yarmouth is insisting.
Thank you, Mr. Chairman. I move to strike the last word. I will be brief. Since we're stuffing the record with statistics, I'd just like to point out a couple of things. One is a national survey just within the last week that more than 70% of the people who have acquired insurance under the Affordable Care Act are satisfied with their plans, and that includes more than 70% of Republicans. I doubt if you would have gotten that level of satisfaction from people about their insurance plans prior to the passage of the ACA. In Kentucky, which is, I think, one of the models of success under the ACA, more than 420,000 people have acquired insurance coverage, either through Medicaid or the private plan, through the ACA, through Connect, our Kentucky exchange. The average premium for those buying private plans is $88 a month after the subsidy, clearly within the affordability range of most Kentuckians. And the statistics in regard to the reduction in unreimbursed care to hospitals and providers, the number of people taking advantage of preventive care services at all levels has dramatically increased. So I think a lot of the satisfaction level with the ACA and the success stories have to do with whether a state actually embraced the law and wanted us to see it succeed rather than trying to sabotage it. And one final thing, I know Mr. Cassidy cited statistics, and one thing that we ought to keep in mind, he very definitely said the difference between 2013 and 2014, which was the difference between when there was no ACA in the private plans and when there was. And I've dealt with a number of my constituents who said they had insurance premium increases of 50 or 60%, and when you looked at their plans, what they had before was a plan that they were paying $100 a month for, which didn't cover anything, which again subjected them to bankruptcy at the slightest accident or so forth. And yes, they are paying more now under the ACA, but they also have coverage which will actually protect them. So we can throw statistics around, they can tell a variety of stories, but the success of the ACA, I think, can be documented where people actually decided to try and make it work. I yield back.
Chairman yields back. Other members wishing to speak? Seeing none, the vote occurs on H.R. 3522, and the clerk will call the roll.
Mr. Hall. Mr. Hall votes aye. Mr. Barton. Mr. Barton votes aye. Mr. Whitfield. Mr. Shimkus. Mr. Shimkus votes aye. Mr. Pitts. Mr. Pitts votes aye. Mr. Walden. Mr. Walden votes aye. Mr. Terry. Mr. Terry votes aye. Mr. Rogers. Mr. Murphy. Mr. Murphy votes aye. Mr. Burgess. Mr. Burgess votes aye. Mrs. Blackburn. Mrs. Blackburn votes aye. Mr. Gingrey. Mr. Gingrey votes aye. Mr. Scalise. Mr. Latta. Mr. Latta votes aye. Mrs. McMorris Rogers. Mr. Harper. Mr. Harper votes aye. Mr. Lance. Mr. Lance votes aye. Mr. Cassidy. Mr. Cassidy votes aye. Mr. Guthrie. Mr. Guthrie votes aye. Mr. Olson. Mr. Olson votes aye. Mr. McKinley. Mr. McKinley votes aye. Mr. Gardner. Mr. Gardner votes aye. Mr. Pompeo. Mr. Kinzinger. Mr. Kinzinger votes aye. Mr. Griffith. Mr. Griffith votes aye. Mr. Bill Rackus. Mr. Bill Rackus votes aye. Mr. Johnson. Mr. Johnson votes aye. Mr. Long. Mr. Long votes aye. Mrs. Elmers. Mrs. Elmers votes aye. Mr. Waxman. Mr. Waxman votes no. Mr. Dingle. Mr. Dingle votes no. Mr. Pallone. Mr. Pallone votes no. Mr. Rush. Ms. Eshoo. Ms. Eshoo votes no. Mr. Engel. Mr. Engel votes no. Mr. Green. Mr. Green votes no. Ms. DeGette. Ms. DeGette votes no. Mrs. Capps. Mrs. Capps votes no. Mr. Doyle. Mr. Doyle votes no. Ms. Schakowsky. Ms. Schakowsky votes no. Mr. Matheson. Mr. Matheson votes aye. Mr. Butterfield. Mr. Butterfield votes no. Mr. Barrow. Mr. Barrow votes aye. Ms. Matsui. Ms. Matsui votes no. Ms. Christensen. Ms. Castor. Ms. Castor votes no. Mr. Sarbanes. Mr. Sarbanes votes no. Mr. McNerney. Mr. McNerney votes no. Mr. Braley. Mr. Braley votes no. Mr. Welsh. Mr. Welsh votes no. Mr. Lujan. Mr. Lujan votes no. Mr. Tonko. Mr. Tonko votes no. Mr. Yarmouth. Mr. Yarmouth votes no. Chairman Upton.
Votes aye.
Chairman Upton votes aye.
Other members wishing to cast a vote? Seeing none, the clerk will report the tally.
Mr. Chairman, on that vote, there were 27 ayes and 20 nays.
27 ayes, 20 nays. The H.R. 3522 is favorably reported. Without objection, staff is authorized to make technical and conforming changes to the legislation reported by the committee today, so ordered. And without objection, the committee stands adjourned.